Hello.
Hi, nice to meet you.
Nice to meet you. I'm here for the family nurse practitioner position interview.
That's correct. I just have some questions for you.
Okay, great.
First one, what are your short and long range goals and how do you expect to achieve them?
Ooh, those are some great questions. That's a good question. My short-term goal is to transition successfully from a graduate training program and into my first role as a family nurse practitioner, and continuing to build confidence in my independent clinical decision making. I also would like to learn from other experienced providers and the way that they work in the organization. As far as short-term goals, I'd also like to strengthen my ability to manage the broad range of primary care concerns that we're going to be coming in contact with every day, as well as continuing to refine my efficiency and my patient flow management. My long-term goals basically is to be a highly competent and trusted provider. I want to be known for delivering highly competent and highly competent care and be a trusted provider. I want to be known for my patient-centered care, as well as building long-term relationships with patients. I plan to achieve this through continued education, seizing mentorship opportunities, staying current with clinical guidelines, and continuously seeking opportunities for professional growth throughout my career.
Awesome. What motivates you?
Professionally and personally. I would say personally, it would be personal growth and opportunities to make a meaningful difference in others' lives through healthcare. Personally, I'm also deeply motivated as a mother and serving as a positive role model for my children and my family. I think it's important to show the value of discipline, resilience, lifelong learning, pursuing goals through the challenging paths. Also understanding that growth comes from pushing beyond your comfort zone and striving for something greater. That's a huge motivation for me, showing my family and my children that. Professionally, I am motivated by the ability to help patients improve their health and their quality of life. I think that fulfillment in educating patients, I love education. So that's something that really motivates me, is being able to deliver that kind of education to patients, as well as building a trusted provider-patient relationship, and knowing that the work that I do makes meaningful impact on patients and within a broader community. Because doing this work is highly motivating.
What does patient-centered care mean to you?
Patient-centered care to me is treating each patient as an individual rather than focusing on diagnoses or medical concerns. It's actively listening to the patient and understanding their concerns and respecting their preferences. The patient should be an active participant in their healthcare decisions. So I want to be the one there to help facilitate patient-centered care with effective being effective to make patient-centered care, combining evidence-based practice, medicine with empathy, education, and a collaboration with the patients, making sure that they feel heard, that they are respected, and they are confident with their treatment plan. I think that that is really important in patient-centered care.
Okay. How do you interact with families and patients?
Interacting with families and patients, when that occurs every single day with each opportunity to do so, I approach every patient and family interaction with professionalism, empathy, and open communication. Establishing that trust is very important in healthcare, especially with some of the different populations that we see. And we need to focus on creating an environment where patients feel comfortable asking questions and openly discussing their concerns. I believe in providing education in ways that are understandable and at the patient's level and individualized to them. I think this allows patients to feel confident about their treatment plan, and the next steps that they need to take in with their health care. And I think that building strong patient-family relationships improves patient satisfaction as well as their health outcomes.
Tell me about your greatest achievement and your greatest disappointment.
I would say this is my greatest achievement so far, successfully progressing through this graduate school while balancing the demands of clinical training as well as my professional responsibilities and personal commitments. Completing this advanced practice required discipline, resilience, and dedication. And I'm really proud of myself and proud of my growth professionally and personally through this process. I think the disappointment I would have to say is earlier in my clinical training, I allowed some of the patient visits to become less efficient, let's say, is a good way of putting it. I wanted to thoroughly address every single concern that patients were mentioning during the encounter, but this kind of caused backups in the appointments for the day and the clinical schedule. So while my intention was to provide comprehensive care, it wound up putting a big cog in the wheel, basically. So I learned the importance of prioritizing concerns and maintaining visit structure, and also appropriately scheduling follow-ups when there were additional issues that arose. This allowed me to, really experience a little bit of a setback, but work through it. And it helped me develop stronger time management, as well as communication skills. And it made a significant improvement. Since then I have made significant improvements in making these adjustments that were needed in order to do more efficient quality care for patients.
Can you tell me about the best and worst bosses you've ever had?
I would say individually, my best bosses are ones who encouraged growth while creating a supportive environment, and as well as learning opportunities. Definitely, I appreciate leaders who provide constructive feedback and communicate clearly, as well as challenge me. They know who each of their employees are, and they're able to challenge them appropriately in order to improve while being approachable and willing to teach. I am not one to shy away from asking questions in certain situations, and it's I love a great boss that I can just go and pop in and ask a few questions, pick their brain, and move along. Some of the difficulties I've had for bosses that maybe were not so great for me was bosses who were unapproachable, that inability to communicate, and or if there was no management, nobody there looking over anybody's shoulders, or a leadership in that aspect. If there were expectations that were very clear, or if they were unclear expectations, or the feedback was limited, or if the feedback was not constructive, those were very, big difficulties for me in previous positions I've held. But they also taught me the importance of effective communication, of teamwork, creating a positive environment with those that I had around me, and making sure that everyone around me felt supported. So I try to learn something valuable even from every professional position I've ever been in, especially whether it was positive or challenging. I think there's always something to learn and take from it.
How would you say you handle stress?
How do
you handle stress?
I definitely think that there is a balance there between work life and professional life. I think at work, one of the things that's really important for me to handle my stress is to stay organized, be able to prioritize tasks, maintaining a solution-focused mindset while I'm at work, especially during busy days and busy situations. I think it's really important to remain calm under pressure and focus on addressing priorities systematically. This has really helped me in the past in basically every position I've ever been in, just applying that mindset of organized, prioritized tasks and getting through them one by one. I think that managing stress outside of work is definitely the cornerstone in preventing any kind of burnout and maintaining a professional performance. At home, I like to do regular exercise, make sure I get adequate sleep, as well as allowing time for rest and recovery in between shifts. I think that taking care of your own physical and mental well-being allows me to remain focused, resilient, and ready for the day. It makes me able to better equipped to provide high quality care to my patients. So through this graduate program, I've been balancing my responsibilities, strengthening my organization because it was really needed, and my adaptability. Day-to-day stressors are a little bit different when you're doing so many things at once. So that adaptability is really important, as well as performing in high pressure situations.
What are you looking for in this job?
In this job, I'm looking for opportunity. An opportunity to begin my career as a family nurse practitioner, where I can continue to grow clinically while also contributing to the organization. I'd like to bring, contributions that are positive to patient care as well as the organization. I'm excited. I'm excited to continue learning while gradually increasing my independence and my confidence as a provider. Also looking for a work that values collaboration, mentorship, teamwork, continued education, continued professional development. And I'm looking for a place where I can build long-term patient relationships while continuing to strengthen my clinical skills and provide high quality, patient-centered care.
Okay. What constructive criticism have you received from employers?
As I mentioned before, the need to improve my efficiency during patient encounters. I think I naturally really harp on building a rapport with patients and ensuring that patients feel comfortable and that they're able to discuss their concerns. And early on, occasionally during my visits, I allowed patients to expand into multiple unrelated complaints, showing that it really slowed down the clinical schedule. So that was constructive criticism that I received. And then after that feedback, I really worked intentionally to improve my visit structure and focus. making sure that I was able to respectfully, I had to build the confidence to be able to respectfully redirect patient conversations when patients went off topic. And also being able to just say, hey, we need to schedule another follow-up when they have additional concerns that require further evaluations that they weren't scheduled to discuss today. So that is something that I have significantly improved upon. I've improved my efficiency while maintaining a strong patient communication and rapport. And the constructive criticism, I think, is a very valuable opportunity to improve. And I do value that, an environment where growth is encouraged.
Very good. Final question. Why did you want to become an FNP?
I really wanted to become a family nurse practitioner because I started my career as a licensed practical nurse and worked my way up through my AA, then my ASN, and became an RN, my RN to my bachelor's degree. And I just noticed that throughout my career, as I was moving along through my education and moving along through my experiences, I had a growing need inside me to push myself further. I also noticed a need within our community for greater access to primary care providers. I came across so many patients throughout healthcare that really were just looking for a good patient-centered primary care provider, and it seemed to be lacking. We've had a lot of patients move to this area from other places, and we have a growing need for more and more providers. I also had a personal desire to take a more active role in patient care management. Over that time, while I was going through different aspects of my career and growing through my education and my clinical experiences, I noticed a shift in the way I was thinking. In a clinical sense, I found myself kind of subconsciously anticipating the provider's decisions when I was going through patient encounters, figuring out the next step, what I would do, what I would order, and just thinking through these, possible diagnoses, considering different applications, management plans, predicting what orders would be placed. And that's when I recognized that the changes in my mindset made me realize that I was naturally beginning to think more like a primary care provider. And it reinforced that I was ready to really advance my role in family, in patient care. So I was particularly drawn to the family nurse practitioner role because it allows me to take care of patients across the entire lifespan, not just one specific area, as well as emphasizing prevention, which is something I believe we really need in healthcare, and patient education, which is definitely one of my true loves, is educating patients, and health promotion, and just obviously the continuity of care. I just find it very fulfilling, building these relationships with patients and encouraging the patient to take an active role in their healthcare. So becoming a family nurse practitioner really allows me to make a broader and more meaningful impact as a provider, rather than being solely a registered nurse.
Well, that's all the questions I had, so thank you very much.
All right, thank you so much. It was nice to meet you.